93% of Americans, Tucker, are metabolically broken. This is extraordinary from the American Journal of Cardiology. And what this means is that we're somewhere on the degree of what I call diabesity. Diabesity is pre-diabetes to type 2 diabetes. And we cut off at pre-diabetes, but that's, 1 in 2 Americans has pre-diabetes or type 2 diabetes. That's bad enough. 38% of teenage boys. I mean, when I graduated medical school, there was no type 2 diabetes. There was no type 1 diabetes. It was juvenile diabetes, which is an autoimmune disease, or adult onset diabetes, which is a foodborne disease. And so now we've changed the names to protect the guilty. And so now we see kids.
Really?
The
names were changed to mask the cause of type 2.
Because kids were getting it. So how do we call it juvenile diabetes if kids are getting type 2 diabetes as young as 2 or 3 years old? It's not their fault. They're being fed, soda. And I once was working in an urgent care in California in an underserved community, and this woman comes in with back pain. She's got a baby in her baby carriage, and he's drinking this brown liquid. And I'm like, what is this, 7 months old? I'm like, what is that? She says, Coca-Cola. I'm like, why are you giving baby Coca-Cola? She said, he likes it. I mean, this is what's happening. And so we're turning our whole society into this metabolically broken society. And this is the driver of all the disease we're seeing. Cancer, heart disease, diabetes, dementia. They're calling Alzheimer's type 3 diabetes because of how it's connected to sugar and insulin resistance. And I co-founded a company called Function Health, which allows people to get insights into their own biology. And what we're finding, Tucker, is that 96% of the people we're testing have metabolic dysfunction.
96%.
96, yeah.
So how do you get insight into your own biology? What does that mean?
So basically, the healthcare system is broken. And I believe that, I could work for another 50 years, and maybe I'm wrong. Maybe with this new administration, we'll leapfrog and things will change, which I'm very hopeful for. But I created a company with a number of other co-founders called Function Health that allows you easy access to your own blood test. It is simple, 5 minutes to sign up, 15 minutes to go into a Quest lab to get your labs drawn. You get over 110 biomarkers or lab tests that gives you insight into everything that's going on in your body that you're not being checked for at your regular doctor's office. You get 5 times more diagnostics. You look at your hormones, your metabolic health, your cardiovascular health, your nutritional health. I mean, your immune health. We've seen 46% of Americans have some degree of autoimmunity, which is crazy. It's one of the biggest cost drivers, whether it's thyroid autoimmunity or other autoimmunity or pre-autoimmunity. We're seeing 67% have nutritional deficiencies. And we give you all the self-care things you can do yourself to optimize your health. So you can upgrade your biology with the insights from scientific literature, from knowledge experts. We've brought in the top scientists and doctors to help inform the content. So it's like having 1,000 doctors in your pocket. Remember the iPod was 1,000 songs in your pocket? Yeah. This is 1,000 doctors in your pocket. And it gives you the ability to do self-care. And like I said, diabetes isn't cured in the doctor's office. It's cured in the kitchen. And that's really what most chronic diseases can be fixed. And I see this over and over.